As research into COVID-19 continues, doctors are finding that even after patients recover, they're still dealing with lasting symptoms. WMAR2 News' Abby Isaac spoke to one of those patients and his doctor about the long-term impacts of the virus.
It was pretty serious. It was pretty serious.
Back in March, 69-year-old Russell Frisbee was diagnosed with COVID-19.
By the time I got to the hospital, I could barely breathe.
He was hospitalized for 5 days and then discharged, but he's still dealing with the lasting impacts almost 6 months later.
It was getting better for a couple weeks, and then sort of the bottom dropped out because I've been a lifelong asthmatic and I have lung scarring.
His breathing worsened and he couldn't even do things around the house without getting winded.
Really impossible for me to work. I was tired a lot. I had difficulty breathing. I was on 4 nebulizers a day plus all kinds of other asthma medicine.
He was negative for COVID-19, but still the symptoms persisted. It's a condition now called long COVID.
And most commonly, we're seeing people with still ongoing shortness of breath and fatigue that can last for months after initially being diagnosed with COVID-19.
Dr. Sarith Raju is caring for Frisbee as an outpatient through the Johns Hopkins post-acute COVID-19 team. He says long COVID is more common in patients than they had expected. And while some have pre-existing conditions like Frisbee, others don't.
We are seeing relatively healthy people in their 20s to 30s who are still having long COVID type symptoms and people who are healthy prior. And I do want to emphasize this is something we're still learning about, and we're still trying to understand what predisposes certain individuals to having these symptoms versus others.
For all intents and purposes, I'm a test subject. Doctors don't know. We expect that by November I should be 100%, but at this point there's just no way of telling.
Frisbee's getting better slowly. He's only just now able to return to work as an attorney since March.
I'm a lot better. I'd say about 90%. I mean, I still am on all the asthma medicines. I had to resume asthma shots.
And he's not alone. His wife is battling long COVID too. She was hospitalized for the coronavirus in April and has been having issues because of her asthma too. They're determined to get through it and spread the message that COVID-19 prevention is very important.
There's nothing we can do about it now except move forward and hope everything turns out for the best.
For WMAR2 News, I'm Abby Isaacs.